Adolescence is a unique phase of human development. Biologically, it's the healthiest part of our life. However, adolescent death rates spike as kids reach their teenage years due to multiple risk behaviors. Globally, the lion's share of disease-related mortality is due to behavioral causes, preventable behavioral causes that have their roots in adolescence. That paradox motivated me to enter public health and applied social science to study adolescents in their social environments. At the doctoral program at NYU, I received very strong training in cutting-edge behavioral science and decision-making science from my mentors, Dr. James Jackert and Dr. Vincent Guillermo Ramos. Especially noteworthy is my rigorous training in research applications of UTB, the Unified Theory of Behavior, which is arguably the best to-date framework for explaining and predicting human behavior in populations. In addition to that, I was trained very strongly to analyze data, large data sets, small data sets, longitudinal data sets, using very advanced methodologies, including structural equation modeling and its many applications. In addition to that, I am trained as a M+ user using a M+ software package, which is probably the best way of using structural equation modeling in today's software world. Lately, I've been serving as a co-primary investigator in 2 studies and 2 sites, one in Bedford-Stuyvesant in Brooklyn and another one in St. Petersburg, Russia, where I come from. Both studies are centered on adolescent risk behaviors such as alcohol use, drug use, and other self-destructive behaviors. In both sites, we are using state-of-the-art decision-making science to better understand mechanisms that impede long-term health and well-being trajectories of adolescents in these 2 very distinct environments. In Russia, we are using the scientific methods to work with a very at-risk population of students in vocational trade schools that are very known for their high levels of alcoholism. And ultimately, we hope to build strong interventions to prevent risk behaviors in both groups of adolescents. I'm looking forward to sharing my background as a scientist, as a medical doctor, as an analyst with a newer generation of social entrepreneurs, social thinkers, social workers to tackle difficult problems of adolescents around the world as a scientist, as a researcher, and as a teacher.